So that's why we're on.
Well, good morning, everyone. I want to welcome you to the Wednesday, July 6, 2022 meeting of the Health and Wellness Advisory Committee for the City of Charleston. And we appreciate everyone who's joined us. I know it's a small group this morning because we're on a holiday week. So we have some people that are out on vacation. I hope everyone had a nice Independence Day, and we appreciate you jumping back on with us and being here this morning. We're going to skip item number 2. We're going to go straight to David Diana, Director of Low Country Mental Health Conference. And he's going to tell us a little bit about the conference, what he has going on, and I'm sure Jennifer Roberts will help him out as well. So I'll turn it over to you guys.
You're muted, David.
Mute.
Well, good morning, everyone. Thanks for having me. And as Kevin had mentioned, my name's David Diana, and I'm the director of the Low Country Mental Health Conference and the director of marketing for the South Carolina Department of Mental Health. And you probably, I'm assuming, have heard a whole lot about the conference through Jennifer, she is one of the founders of it 10 years ago. When we were looking at some opportunities to have a conversation around the issue of mental health within our community, and the conference was one of those endeavors that sort of took off and took a life of its own, and has become quite a big event that's gaining not only national attention but international attention and reputation. And so it's allowed us, for the city of Charleston, it's allowed us to invite speakers that we would not have had the opportunity to invite maybe early on in the process, just for them knowing what the conference is all about and the quality and credibility of it. So that's been very exciting. And so I just wanted to share with you a few things about the conference. It's a 2.5-day event that's taking place July 27th through the 29th. So the 27th, which is a Wednesday, is a pre-conference session. So if folks wanted to have a smaller kind of a breakout type of a session and meet some of these speakers in a bit more of a closer setting, then that's something that we offer that evening. And then the real meat of the conference is 2 full days on a Thursday and Friday, July 28th and 29th. And the Low Country Mental Health Conference is held at the Gilliard Performance Center. And we offer a hybrid event, as most events nowadays with COVID. We did this last year in 2021, so people can register and view things virtually, but also obviously come to the Gilliard and join us as a community there. And thanks for putting this up. What you're looking at right now is just the 2-day schedule, and we will get that sent out to you if it hasn't been already. And I'll also put in the chat the web address for you all to register. This is a conference for mental health professionals and people out in the community who are just interested in wellness, mental health, personal growth, whether it be their own or that of loved ones. So this is really a celebration and a conversation around mental health in general. Certainly a large portion of the folks that are coming. And so if you're affiliated with healthcare in some way or in a healthcare setting, or they're a healthcare provider, it could be psychologists, psychiatrists, counselors, social workers, nurses, educators, anybody who's in that realm. We get a large grouping of those folks who are coming. And then we're also getting a fair amount of people just out in the community who are just interested in some of these topics for themselves, and also the resources. So not only do we have 2.5 days of great education opportunities, but we'll have 90 plus organizations that'll be exhibiting for the 2 days. So just that alone, in terms of knowing and learning about the different resources that are out there in our community and beyond, is pretty invaluable. So we're really excited to have those different organizations there as well. This is our 10-year anniversary, so it's we're really excited about that and that 10-year journey that we've taken to get here. And so it's really a celebration of that as well. So we have some performers. So just we who are big mental health advocates. To give you an example, on Thursday, July 28th in the afternoon, we're going to have Stephen Page, who's a musician and the co-founder of a band you may have heard of called the Bare Naked Ladies, who's I think back on tour now, Jennifer. And he's going to give a live acoustic set, as well as talk about his challenges around mental health and his successes, and his being a mental health advocate. We have a comedian, Jessica Holmes, the power of humor, in regards to mental health is certainly important. And so she's also written a book on her struggles with depression, and she's going to perform for us on July 28th as well. And then on the 29th, we're going to close things out with a musical performance from a band known as Wild Ponies out in Nashville, which is a country/rock and fusion band that's been with us before. The woman who's the founder of it has struggled with a lot of trauma, and she's going to talk about the creative process. And for her, it was writing and music as a healing component. So, and they're quite talented. So those are just the performances. We have speakers that are coming from all over the world. So I have a well-known psychologist named Bayo Akomalafe, who's a Nigerian psychologist who lives currently in India, who's going to be flying over to talk with us. And he's going to talk about trauma and healing, but he's going to talk about it from a worldview perspective. So it'll have a Western component and have a non-Western component, which I think will be really valuable and interesting for us. And he's quite dynamic and powerful. We have some incredible researchers from some of the leading educational institutions in the United States. So from Stanford University, we have the Chief of Addiction Medicine, Anna Lemke, who's going to be talking and sharing her work that she's done in research around dopamine and the issue of addiction and sort of this overstimulated world that we're all in at this point in time, which will be quite fascinating. And then I have Yale University professor Woo Kyung An, a psychologist who teaches one of the top most popular courses at Yale. It's called Thinking 101. And she's going to be sharing her work and her research with her lab on the issue of thinking, how it impacts our mental health, our perceptions, how we view things, and what kind of outcomes come as a result of sort of where we're coming from that standpoint. And then we have Dr. Gabor Mate, who is a physician, quite well known across the world. He's Hungarian born and from Vancouver, Canada. And he's going to work with a colleague of his, Sat Dharan Kaur. They're going to do a half day on July 29th, work on this model they call the compassionate inquiry therapeutic model, which is very valuable. It will be very valuable for our clinicians, but also just in terms of folks in the community in general, because it's going to talk about how we explore the unconscious and those unconscious dynamics and how they may run our lives and what we can do to sort of break that pattern or that circuit that may have us stuck in some place, in some form. And so we have all different kinds of talks. Those are just a few of them. We have local folks, Reverend Byron Benton from Mount Moriah Missionary Baptist Church. He is joining us. He's going to share a Christian perspective on understanding trauma and on mental health and well-being. And then we have, I have the Venerable, I guess if I say this correctly, Dakpa Tapyal, who is a Buddhist monk of the highest order, who is the head of the Charleston Tibetan Society, who's going to talk about mental health from a Buddhist perspective. So it's, I think, going to be a really fascinating and enlightening conversation around mental health for the 2.5 days. We would love to have not only you join us, But we would love for you to help spread the word these last couple of weeks across our communities and let people know about it. It's under $60 if you're not looking for continuing education credits to come for the full 2 days. And it's around $45 or so to come for 1 day. So it's very reasonably priced. You get to learn from some really innovative work that people are doing around mental health, as well as we'll have some great entertainment. And then again, the 90 plus exhibitors that we'll have with us. So I'll share in the chat a URL so that people can kind of go there. And thanks, Jennifer. We need volunteers to help us with the conference. We will have around, I don't know, anywhere from 1,000 to 1,500 people in person. So it'll be a large event. And then we're going to have about 500 or so people who will be watching us from all over the world virtually. And so it is a big undertaking. We'd love to have some volunteers. So if you'd like to volunteer, if you know of others, I'll also give you my email and you can reach out to me and we'll get you connected. It's a great team. We get a lot of feedback about how well the conference is run. And like I said, it's become an internationally recognized mental health conference. And we'd love to have you. The virtual experience is pretty unbelievable. The Gilead, we've been with them for, I think, 5 years now, and they treat us quite well. So their production team manages this virtual realm. And what I was amazed by is that we launched it last year is the interactivity that came with just being in your own office or your home. You're able to ask questions real time of speakers. There's a community of folks on the chat that are talking to one another as the talks are happening. The visual component and the audio is of the highest quality. So it's really quite impressive. So if you can't make it, although we'd love to have you, that is a real viable option for you to take a look and see. So I don't know, Jennifer, is there anything else that I'm missing that we need to emphasize about it?
No, and I told Paul, and when David said, Jennifer talks about the conference, I'm like, but not like David does. But there also might be a little secret surprise coming from Mayor Tecklenburg as he opens the conference on.
Yeah, I didn't want to say it, but we're gonna, he's gonna be opening it, and I think we're working on him possibly doing something special to kick it off. So there'll be a lot of different surprises, and yeah, as Jennifer had mentioned, I mean, it's a labor of love for me. I'm real passionate about it. Charleston Dorchester Mental Health Center and Mental Health Heroes have basically created one of the best mental health conferences in the country. And so, I'm real proud of that. And so if you haven't come, please do to come see what it's all about. Because I also think it's really great that, our city hosts every summer a conference of this caliber in the area of mental health, which is just at the forefront of a lot of discussions over the last couple of years. And it's quite critical and important to everyone in our community. So we're real proud of it.
Thank you, David.
Yeah, and if there's any questions, I'm certainly happy to answer. And I'll put the web address, Paul, into the chat room right now.
Paul?
Yeah, and I'll just add that volunteers. I know some folks on this committee work in large agencies. You work in colleges. You work in hospitals. Anybody and everybody is invited to help volunteer. They can obviously attend at no cost if they volunteer for at least 4 hours throughout the conference. So it's a good opportunity to come and help us out, and then also not have to pay to go. So we would love to have volunteers. That we're trying to reach out to our students, our interns, and things like that. But if you guys know anybody interested, please either reach out to me or David.
Yeah, great. Paul?
Kevin, I just wanted to add that the last year I attended, and the speakers were spectacular, but the best part that I had was going through the expo hall and the wonderful resources statewide that are in that room to help us locally, that we can just take from them and put it into our work right now is is really outstanding. And probably, I think the best part of the conference is that expo, because you've got all the leaders right there to help out. So I just wanted to toot the horn for that part of it.
Very good.
Yeah, thanks, Paul. And then we have a local bookstore, Buxton Books, that's over on King Street, not Upper King, it's over on Lower King. They are phenomenal to us. So we will have like a full-on bookstore at the exhibit hall as well. Most of the speakers that we have written several books, and some have a few that are coming out that are gaining a lot of traction and attention as well. So yeah, if you went to the website, there's a speaker page there where you can get a feel for all the different speakers that we have coming, and as well as obviously the schedule.
Yeah, and lastly, I just want to say that because of Mental Health Year is our supporting nonprofit, that's why we're able to put it on. It would be too difficult. It'd be impossible as a state agency to put something like this on. But all the money raised goes to help patients at the mental health center and in the community, pay for rent, medications, you name it. Just so that's where the money's going. So it's all going to a great cause.
Yeah, thanks, Jennifer. Because I mean, yeah, it's a great cause as well. So that's sort of even the cherry on top for the whole thing. So we hope you'll reach out. I put in the web address now in the chat and my email, and would love to hear from you. And if I can answer any questions you may have, just email me as well. And really appreciate the opportunity.
Very good. Well, thank you, David. Any other questions or comments before we move on? Well, David, thank you so much. That's a great presentation. I mean, obviously you've got incredible expert speakers and awesome entertainment, affordable, great value. And we are so fortunate to have that in our city facility at the Gill Yard down there, and to have everybody coming into the city of Charleston. So thank you for all your work, everything you've done on that. We really appreciate it. So thank you.
Yeah.
Thank you, Jennifer.
Thanks, Kevin. And I'll talk to you later, Jennifer. Paul, thank you so much. Everybody have a great day. And I hope to hear from you soon.
All right. Thank you again.
Bye.
All right. So next up, we got Jamie Roper from the Mayor's Office on Aging. And she's got a brain health challenge, and going to give us a little community highlight update here. So Jamie, if you would.
Good morning, everyone. On last week, which is June 27th, the city held a mayor's roundtable on brain health, in which Mayor Tecklenburg opened for us playing the piano. That roundtable was sponsored by my office, which is the City of Charleston Mayor's Office on Aging, and the Alzheimer's Association, which I also serve on the board of directors. The whole idea for the brain health roundtable was to provide the community information on brain health and some of the diseases like Alzheimer's and other forms of dementia, the brain disease that deteriorates the brain. Normally those diseases kick in at about age 65. But we have discovered that it's becoming earlier and earlier, people in their late 50s. There are people who, as young as in their late 40s, have now started to develop different forms of dementia. So we wanted to make the city, first of all, aware of that disease and how it deteriorates the brain, and the local resources like the Alzheimer's Association that are available locally to help those families who are struggling and who have become caregivers for the people suffering with those diseases. Also, above that, we wanted to tell people how they can go about preventing the disease. And that is where the challenge came on. We discussed the 4 pillars, which is cognitive learning, diet and nutrition, physical activity, and social engagement. Those are the 4 pillars. And our challenge was for organization, churches, anyone in the city, any organization or group, to take on one of the pillars, to gather a group of people, as many people as you can, and get as active as you can in doing one of the challenges for one of the pillars. We would also support the activity, in which, for example, if there was an organization that wanted to learn how to salsa dance, we have dance instructors who are willing to give a free class to get you started. If you wanted to do a nutritional eating gathering, we have chefs that will come and help you either prepare a meal or give you recipes that are healthy for healthy eating. The whole idea is to engage those 4 pillars of your brain to help prevent the disease. We challenge people to start young as possible and get as active as possible to preserve the brain, because research has shown that the more engagement you have with the 4 pillars, the more healthier you eat. If you continue to learn or be cognitively engaged, that it's better for the brain. The more activity, daily exercising, 150 minutes a week makes a major difference. Something as simple as adding a lot of water to your diet. One of the challenges I have taken on is I will only drink water for the next 45 days. So being a Charlestonian, it is super hard to give up my sweet tea, but I am going to challenge myself to do that. And hopefully as we start the challenge, it becomes a natural lifestyle change, because the challenge is 45 days from June 27th until August 11th. And once we'll follow those groups who are interested in the challenge, at the end of the challenge, they will win keys to the city and some other surprise gifts. But we want people to become active. We want to do all that we can to preserve our brain so that, years from now, we can remember our loved ones, remember our lives. Because one of the things that dementia does, it robs you of who you are, your entire life that you've lived, and all the people that you've loved and been devoted to within your life. We want to prevent that for as many people as we can. So I challenge all of you here to reach out to my office and join the challenge, and let us help you live a healthier lifestyle. Are there any questions that I could answer for anyone?
Paul?
Paul, you're mute.
You have a form for people to use to register?
Yes, I do. And I will send that to Paul so that Paul can send it to all of you, or you can reach out to me directly. My office number is area code 843-577-1306. And that's the City of Charleston Mayor's Office on Aging. But I will send that form to Paul so he can send it out to everyone. So join us in the challenge. I challenge each person on this video right now to join the challenge. Do what you can to preserve your brain.
You also have a second challenge that you would like to, of all the ones that are listening in or here, if you have a special talent, like the salsa dancer is an AmeriCorps worker in the Mayor's Commission on Children, Youth, and Families. The chef is somebody who is a friend of somebody who's volunteered to be a part. If you have any skills or know of people that could help out, like going to these churches and talking to talk to about nutrition, or I say churches, community groups. If you've got talents out there that we could get to Jamie to, let's say, hey, I would be glad to do this in a community or something. Those are the type of things we need to help out to make this challenge work that much better. Just, you can talk nutrition, if you could talk anything of those natures. And Nick, any way we can combine the Low Country's resources to help out these communities this is an opportunity for us to really sell why being healthy matters. And Jamie is open for those resources to help fill that treasure box of hers.
Thank you so much for that, Paul. And no matter how small or how large your talent may be, I'm pretty sure we can find a use for it. So definitely volunteer those skills.
Very good. Thank you so much for that. Any other questions for Jamie Roper? Jamie, thank you so much for bringing that to our attention and presenting that to us. We really appreciate it. And hopefully we can get out and spread the word and get some things going here. So.
Kevin, I will say the city is taking on the nutrition side, and they are going to do for the 40 to 45 days, they are going to really push dieting and healthy eating during the summertime to see what we can do to get people thinking about what it does and how it affects the brain and everything else. So
Kevin, let me share one last tip with everybody. One of the things we've discovered in the dementia research is one activity that activates the most part of the brain is learning how to ballroom dance. For some reason, ballroom dancing, the steps, the activity, and the music has one of the most engaging activities in the brain. So I'm going to learn how to ballroom dance, guys.
Our DHEC medical health director might be able to teach everybody how to ball dance.
What about Wordle? I'm hooked on Wordle. Does that help?
Yes, it does. Yes, it does. Wordle and Wordscape. That's what I'm doing.
I like both of them.
I just want to end on one other story that Jamie told during the conference. And Jamie, you want to talk about not about your health issues, but what you learned during your health recovery period about eating.
Last year I had a major surgery and I was out for about 90 days. But doing that surgery, I was bedridden. I had to use a walker. So I couldn't leave my home. So I depended on my grandniece and my neighbor to do all of my cooking. So I could not eat out at all. So I gave up all my Chick-fil-A and everything. So I don't cook. So I had to eat whatever they prepared for me. And both my niece and my neighbor eat very, very healthy. So at the end of that time, I went back to my doctor and did blood work. And I've been a borderline diabetic for years. My number has been like 6.9, 6.8. Went back to my doctor and he was like, Ms. Roper, I don't know what you've done. He said, you've lost weight. Your blood work is fabulous. He says, your blood sugar is now 5.8. My blood sugar has never been that low. He says, your cholesterol is low and it's really, really good. He said, your blood pressure has gone from, I think it was 130/97 to 71/107. All of that just from my eating changes. So I was able to make that major change, not exercising, not doing anything, just by changing my diet. And I remember that mostly what I ate was a lot of vegetables and protein. So I didn't do a lot of carbs. So I said that to share that because even if you make small changes, it will make a major difference. And I was vastly shocked. So I've tried to continue that in that healthy eating. So it takes the small steps, guys.
Very good.
Thank you.
All right. Well, Jamie, thank you again. We really appreciate you spending some time with us and talking to us about this. Great presentation. We'll move on to our community health update. And we have Dr. Katie Richardson with us, if she would kind of give us an update from here.
Thanks, Kevin. Good morning, everyone. I thought I would start with something non-COVID, although I'm definitely going to put some COVID in there. But I did mention monkeypox last time. I just want to mention that again. There are now 460 cases in the U.S., over 32 states. South Carolina has not yet diagnosed a case, although we have tested several people. But really, I think that the message to the general public is if you have an unusual rash, certainly if anyone tells you that they have monkeypox and you may have had skin-to-skin contact with that person or contact with their towels or bed sheets, please let your provider know, and your provider will get in touch with us here at DHEC to talk about testing. Testing up until now has been exclusively through the CDC, through the health departments, but there are now commercial labs beginning to offer the testing as well. So we've seen most of the cases in California, Illinois, and New York. So far, so that would be another risk factor if anyone has unusual rash and has traveled to one of those areas, as well as Europe has seen a significant number of cases. I also want to mention rabies. So in the summer, when we're out and about outside, we do see increased risk for rabies. That is a virus transmitted from rabid mammals to other animals or humans. Here in South Carolina, we most see rabies associated with raccoons and bats, although any mammal, including dogs, cats, ferrets, foxes, can transmit rabies. So I think the message there for the general public is if you were bitten or scratched by a wild animal or by a dog or cat that you do not know, or whether it's a friend's animal or your animal, that does need to be evaluated. You do need to talk to your provider, and we do have a bite report form on our DHEC website so that our rabies program is able to reach out to that bite or scratch victim so that we can evaluate, the need for, there is great prophylaxis in the form of immune globulin and rabies vaccine. But we want to make sure that those who need it are getting it, that those that are, for instance, have been bitten or scratched by, say, a neighbor's dog, that we're able to observe that dog. And that's not necessarily a reason to go out and start rabies vaccination. So we want those who need it to get it, but are happy to help you sort of walk through your risk, as is your provider. Now I want to talk a little bit about COVID. Tracy, do you have anything you'd like to add around the city's work on COVID?
I've kind of stepped away from our COVID work, so Paul might be better equipped to talk about what's happening in the city.
Thanks, Tracy.
Yeah, I would say that COVID is starting, we're seeing small cases on a regular basis, but the largest ones are coming from close contacts that are outside and people going to dinner with others and all. And the more we can just remember to keep washing hands and social distancing, even when we're out, is very powerful for locally. But I don't see that large of a trend happening. There are some flus. I wanted to ask you about the flus that are going on, because that seems to be some parallels are running with COVID right now with people. So
on a population level, we are not seeing a ton of flu cases. Certainly, it is a good reminder that flu continues, through the summer and really can be year round, associated with travel or not. And yes, I too have heard of people testing positive for the flu, having symptoms, not sure whether it's COVID or flu or something else. Some are testing positive for COVID, some the flu, and some for neither of those. So yes, there is some flu, but generally it's quite at a low level right now. COVID is certainly the more common diagnosis with those respiratory symptoms now. We are seeing increases in those subvariants of Omicron, BA4 and BA5. Those are more transmittable, although we do not yet have evidence that they are more severe. So that means more likely to catch it, but no more likely to be hospitalized or have other severe consequences from it. They are linked to more what we call immune escape. So we are seeing more people who may have recently had a COVID infection that are again developing COVID from these new subvariants. So the prior infection is not as protective as some others because of these subvariants. We did see the FDA last week recommend to vaccine companies to update their booster shots to include this BA4 and BA5. We suspect that will be available early to mid-fall, but don't know an exact time for that. And currently the booster vaccines, as well as the primary series vaccines, are considered still effective, and we do recommend not delaying until these new boosters are out, unless perhaps you've already had your first booster and you're considering your second booster and not in one of those high risk categories needing the second booster immediately. We are seeing some increase in hospitalizations, both nationwide and in the low country. We are seeing an average of almost 400 deaths daily, still nationwide. We see between 2 to 4 deaths weekly here in the low country. So COVID is certainly still with us. It's unclear what will happen after the July 4th weekend. We certainly saw record numbers, flying through airports here in the U.S., higher than any time since the pandemic began. And we did see a spike last year, this time sort of beginning in July. But it's really too soon to tell what the effect will be from travel. We did see a JAMA article come out last week looking at Italian healthcare workers infected with COVID. It did suggest that those with 2 or 3 doses of the vaccine had a lower prevalence of long COVID. So I think that is still important reason to emphasize for those who have not yet gotten their vaccine or not yet gotten their booster after their primary series, that a decreased risk of long COVID is a great reason to consider vaccination if you're still on the fence or haven't gotten sort of all doses available to you now. Charleston, Berkeley, and Dorchester County are still in that medium community transmission level. So that is the level that says, as Paul was saying, please think about your hand hygiene. Please consider wearing a mask if you're in a high-risk situation or around high-risk people in your family or community, or if you yourself are high risk. Also on the vaccination front, since we last met, the CDC and FDA have recommended both Pfizer and Moderna for those ages 6 months and over. So Moderna is now available for those 6 months to age 17. It had not been available for the older children as Pfizer was previously, and Pfizer is now available for ages 6 months to 4 years of age. Pfizer is a 3-dose series as the primary series for those younger kids, and Moderna is a 2-dose series. And so I do think, I think much of our messaging around, why should young children get the vaccine is that it's still one of the highest sort of reasons for death in this 0 to 4 age group. In the under age 1 group, it's the 4th leading cause of death, COVID. In the 1 to 4 years of age, it's the 5th leading cause of death here in the United States. And so while it may not be as dangerous as it is for older people, we have a vaccine that prevents those severe consequences. It's also, as effective as not, if not more effective in preventing deaths than even other vaccine preventable illnesses. So for instance, with varicella, there's an average of 16 deaths a year that prior to, prior to varicella being recommended as a vaccine. And COVID-19, there was an average of 86 deaths a year. That's in that 6 months to age 4 age group. So we certainly continue to strongly recommend all childhood vaccinations. This is a great time to think about getting those prior to school. There are school requirements for kindergarten, for 7th grade, and all grades in between. And so this is a great time to not have to take kids out of school to get those well child checks done and vaccinations. But the COVID vaccine has the ability to prevent more deaths than any of our other childhood vaccines, given how prevalent we are seeing COVID and have seen COVID over the past few years. Other than that, well, I already talked briefly about that second dose, but it is clear now that CDC and DHEC, and I may have mentioned this last time, I can't remember, that there is a recommendation now for everyone age 50 and over, with or without underlying medical conditions, to get that second booster dose. And that's at least 4 months after the first booster. And then anyone who hasn't had their first booster, at least 5 months after their primary series. That has been a recommendation for some time. So I think I'll stop there. For those interested in vaccination for any of those doses, the Vax Locator on the DHEC website still is a great source for knowing where in the community the various vaccines are available. And the care line through DHEC is also happy to help anyone navigate where to find the vaccine that they may want. So happy to answer any questions.
Any questions for Dr. Richardson? Well, thank you very much for that update. We appreciate all that you do, as you always do so much for us. And we really appreciate it, Dr. Richardson. Thank you so much. So we'll move on to our community updates if we have any. If anyone has anything they want to report out on as far as a community update. Anyone?
I'll just remind everybody what Susan Johnson has talked about a couple of times. The South Carolina 7 is the walk or the exploring of the waterways from the Appalachians down to the Atlantic. And that has started this past weekend, and they'll be down in the Low Country area later on the last week of July. But if you want to look it up, look up South Carolina 7, the number 7, the word South Carolina, the number 7.com. And you can see what kind of events are going on in the Low Country that last week. There's a kayaking and some nature walks are out in just to explore the East Basin area and all. So wonderful opportunity to take advantage of that. Remind everybody about we need to get the information out about protective sun screening and hydration. So with these high temperatures, the hydration is the biggest issue. So if you need help with information, just reach out to me, and I'll try to make some connections for you, or in any direction. But we just need to keep passing our message on is what we can do better coming up. And
thank you, Paul. Appreciate that. Very good. And Joey, I think you have your hand up.
Thank you so much. So just wanted to remind folks that every 3 years, our regional health coalition, Healthy Tri-County, performs what's called a community health needs assessment. And what it is, it's a brief survey that we're asking everyone in the community to fill out, which really helps guide kind of the work of our health coalition around what the biggest health priorities are for our community members. And so certainly, this is part of a more regional assessment, but the folks within the city of Charleston are certainly an important part of that. And so I just wanted to share with the folks who are on this call that if you are interested in getting the surveys are for our health needs assessment, I'm happy to send them out. We have an electronic version in English and Spanish, as well as paper copies. And the more folks that we can get across all socioeconomic statuses and different diversity levels, the more complete kind of our data set will be, so that we can then prioritize our work efforts over the next 3 to 5 years. And so just wanted to share that with folks. I'm going to put my email address in the chat. Please contact me if you would like some of these surveys, or if you would like the little postcards that have a QR code that you can hand out to folks to get them to fill that out. The last health needs assessment that we performed 3 years ago, we got over 5,000 responses between Berkeley, Charleston, and Dorchester County. And so we're hoping to get numbers at least that high again this time around. So once again, we have electronic versions, we have paper versions. We have some incentives tied to organizations who are willing to help us get this survey out to folks. And we also have some incentives tied to individuals who take the time and effort to fill this out for us. And then lastly, just as a reminder, we don't collect this data and then not go back to the communities that we're collecting this data from to share out kind of what the plan is and what the work efforts have been. And so we kind of have what's called a roadshow once we collect our health needs assessment data, where we can go then share out what things look like on a community level, what health priorities folks are facing and what issues they're facing. And so I just wanted to let this group know that in the coming months, once we collect that health needs assessment data, we will be setting up what are called kind of data walks, where folks can see what folks are reporting. And the one distinction between a community health needs assessment and kind of like more population health data is that this is a primary data collection. This is coming directly from folks in the community where they're saying, here what my biggest issues are. In the past, we've noticed that access to care in terms of transportation and getting signed up for health insurance have been some of the top needs for folks. But there are also other topic areas that we see time and time again around nutrition, physical activity, mental health, cancer screenings, things like that. And so we just really want to collect this information and use it in the best way possible to help us in our health efforts, and it helps everybody in the community. So just wanted to share that out and let folks know we're really pushing and we're the next over this summer to get that survey sent out to everyone. And our hospitals have been super helpful in this, Roper and MUSC. So we can't thank you guys enough for it, but I'm going to put my email in the chat. Please let me know if you would like to participate and I can send a bunch of surveys your way.
Thank you, Joey. Appreciate you bringing that to our attention, bringing that out to us. And I think Jennifer Roberts has her hand up.
Yeah, thank you. I just wanted to make sure everybody's aware of something else we've been doing since the 80s. And we have a mental health task force that meets every other month. I think it's the first Friday of the month. It's this Friday. Actually, it's the second Friday of the month. But if you are interested in joining, let me know. But basically, it includes hospitals, homeless, a lot of different agencies working with the homeless population, drug and alcohol services. We have probate court judges, we have law enforcement, we have EMS. I mean, basically anybody who's interested in mental health needs, goals, if you have issues or questions. And it's kind of grown over the years. And so any and everybody is invited, and we basically just share what's going on with our agencies and share resources. And I thought of you, Jamie. I think that you guys are coming now, but really anyone who would like to get information, it's a wealth of information. So if you're interested in joining, please just send me an email and we can include you to the list. We're obviously still doing them virtual, but we used to do them in person. And one day we hopefully will do them in person again and serve breakfast. But I just wanted to throw that out there because it occurred to me it's this week. And we'd love to have anybody that's interested in kind of sharing information about what you're doing or looking for information.
Great. Thank you very much. Dr. Richardson.
Thank you, Kevin. Paul reminded me of two more things. So given we've got a little bit of time, I just want to give a brief update on the new social services hub for Charleston County. That building is still on schedule. It is at the corner of Rivers Avenue and McMillan. And I know DHEC will be moving in sort of the first 2 weeks of November. And I don't know where we fall in the sort of, the Otis and DSS and others moving in, whether that'll be at the tail end or the beginning. But that building will be open for business, if not sooner, at least at the beginning of November, with pretty much all DHEC services for Charleston County in public health. Environmental affairs will stay in their building on McMillan, but we will be moving there other than our Mount Pleasant clinic will continue to be located where it is now, pretty much at the IOP connector. Also with our Fast Track Cities initiative to end the HIV epidemic, we are hoping to hold our first community chat in the city of Charleston, downtown in September, and hope to really focus that on our young adults. in the Charleston Tri-County area. So more to come on that, but we are looking for a location and looking for speakers to be involved, and would love any and all of you interested in attending. So when we have an exact date, I'll let you know, but that will be in September. Thank you.
Very good. Thank you. Anyone else? Anything else before we adjourn? Just want to thank everybody for your time. I appreciate you spending some time with us. We're halfway through the year, so make the second half of 2022 a good one. Want to thank again, of course, David, Diana. Remember that he needs some volunteers. Jennifer needs some volunteers there for the Low Country Mental Health Conference. And if you can't volunteer, if you can attend, and that just looks like it's going to be an outstanding event. And remember the Brain Health Challenge with Jamie Roper. Just want to tell you, thank you. Hope you have a great July, and we will see you the first Wednesday in August at 9 o'clock if we don't have anything else. If not, we are adjourned. Thank you.